you've been struggling, trying to figure out what's the next step, well, I want to let you know where you can find it. You can find it in the will of God. I wanna be in your will, in your will. Lord, I wanna be in your will, in your will. Oh, in your will, oh Lord, in your will. Lord, I wanna be in your will, oh Lord, in your will. Oh Lord, I wanna be in your will. Lord, I wanna be in your will, in your will, in your will. Lord, I wanna be in your will, in your will, in your will. That is where I find joy. That is where I find peace. I wanna be in your will, in your will. Oh, Lord, I wanna be in your will. Praise the Lord and God bless you. Thank you all so very much for tuning in. We pray that this time that you'll share with us will be time well spent, or not time necessarily spent, but time well invested. We believe that your life will be definitely enriched as you hear this conversation on tonight. What we're talking about is COVID-19 healthcare commentary. So we're going to be talking a little bit about this whole process that people are still going through with COVID-19. We have some people that are connected to the ministry, and they are still yet frontline workers, and they're going to be sharing with us some of the things that they've experienced and are experiencing as we go through the mid part or the latter part of this whole COVID-19. So we're going to start bringing them up, and we're going to introduce them to you so that way you can know who they are, and you can ask them questions even as we're asking them questions as well. First of all, we have Dr. Sonia Cook. We have Minister Jovita, and we also have Minister Valerie. So we're going to bring them up, and we're going to have them just tell us a little bit about themselves. And as they tell us about themselves, tell us what it is they do, where they work, if that's something that they're able to do. And then we'll go into the conversation. We'll start in the same order that you told us.
Hello, my name is, all right, thank you. Thank you very much, Pastor and Pastor-elect. My name is Dr. Sonia Cook. I am a nurse practitioner. I've been a nurse practitioner for about maybe 15 years or so. I currently work doing home visits for United Healthcare.
Greetings, I am Jovita, and I work in occupational therapy. I'm a certified occupational therapy assistant, and I have been practicing for 13 years. And I work in home health as well as skilled nursing facilities.
Praise the Lord and God bless you all. My name is Valerie Pendergrass. I'm a registered respiratory therapist. I've been a therapist for 17 years, and I'm also a registered nurse, and I work here in Columbia at Providence Health License.
Amen. We thank God for having you all on tonight. We're excited about the conversation that we're going to have. We're going to turn it over to my wife, and we'll let her start out asking the questions, and then I'll come and chime back in from time to time as well.
All right. Well, we thank you again for coming and sharing. We're just so glad to give us a sacrifice of time. One of the questions that we have, we know that the pandemic is still, on the rise, is still, existing. So we wanted to know, just from your perspective, how does healthcare look right now, presently? I know a lot of people are getting excited because, the stores and everything, businesses are opening now. But how does that look in the healthcare field as it relates to COVID-19? And that's for anybody.
Well, we have to still remain cautious when it comes to going into work and taking care of your patients. Even though everything is opening back up, as a healthcare provider, we still have to be mindful to use our PPE properly. Even with patients that have not been diagnosed with COVID, we have patients that are ruled out COVID, so they're waiting for test results to get back, and we can't get lackadaisical or careless in how we protect ourselves and how we protect our patients. So we still have to be cautious in healthcare, even though everything is opening back up.
So rule out COVID means that it's a possibility that they could have it, but you're still awaiting testing.
Yes, sir. Some patients, so many patients present so differently. You have some that come into the hospital and they have temperatures. Some don't have temperatures. Some oxygen levels are low. I don't want to go too deep, just in case someone doesn't understand what I'm saying. But the signs and symptoms that they present with are so different. However, there are some patients that we put in certain areas as they await their test results. So yes, that's what COVID rule out mean. It means that they have signs and symptoms that point towards COVID. We're not sure until we test them and get the results. So yes, sir.
On my practice, I treat everybody just like they have it. I'm still wearing my PPE, washing my hands even more. So that's one of the things that I'm continually doing, even though, the state has opened back up. I'm just treating everybody like they have it.
Absolutely. Likewise.
So with that being the case, how does that really affect what you do, Minister Jovita, being that you are touching, working with dexterity and all that kind of stuff? How does that affect you? Do you have to wear PPEs and stuff as well, or not?
Yes, I wear PPE depending on what I'm going to do with that particular patient. So I do ADLs, which is activities of daily living, which may mean I may do bathing, I may do a dressing, and those are physical contact types of activities you have to do with the patient. So I wear gowns when I practice in that type of doing ADLs. Definitely wear gloves and a mask, a medical mask, and shields sometimes, depending on if the patient is having some symptoms. Because, like Minister Valerie said, some people can be asymptomatic and you don't know. So just depending on what the patient, and we're doing a lot of screenings before we even contact the patient, which is something that occupational therapy don't normally do, so we don't normally take temperatures and stuff like that. Now in home health we do, but skilled nursing facilities and hospitals, occupational therapy, that's something that nursing usually do. We allow the nurse to do those vital signs, but now because of COVID-19, we're having to do more screenings before we even touch the patient.
From my perspective, with also doing home care, we are not currently in the field right now. We've actually moved towards virtual healthcare, doing virtual visits via FaceTime, Skype, and various mediums, also on the telephone, because we want to make sure that we keep our patients safe. First and foremost, we do have PPE, but we want to make sure that we have an adequate amount of PPE before we do go back out into the patient's homes. And the patients really are appreciating that at this point. But along with what Minister Valerie said, we continue to be careful and cognizant of the situation, and that some people do present asymptomatic or even symptomatic, and some people are actually carriers that don't know that they are carrying the COVID-19 virus. So we want to be mindful of that.
How is that affecting your work, having to do a lot of it now via Skype and video medicine, telemedicine, that kind of thing?
It's a little bit different, being able to have that contact, being in person with the patient is it gives you a lot more data than just talking to a patient or seeing them on a video chat. Being able to do their vital signs or look at their feet or do the various things that are part of a physical exam, I'm not able to do that. So I'm limited to just being able to observe for my exam, and it can really impact what I do as far as diagnoses.
So they're responsible for doing their own temperature and blood pressure there. So you have to rely on their competence as it relates to that.
If they have that equipment. If they have that equipment, then they can. Otherwise, all I can do is screen. And that's what everyone is doing. Like Minister Jovita said, and Minister Valerie said, we're screening everyone to make sure that they have, that they don't have any symptoms or any contact.
And we just received a question. The question was they're offering COVID testing. And so would you recommend getting the testing to get it? I know we're in and out of stores sometimes, going to the gas station. Would you recommend because it's been offered, or should you just wait until there's symptoms?
That's a good question. That's a personal question. Because you can be negative today and positive tomorrow, and you really don't know, but the testing is available and it is free for the most part. So if you feel like that's an extra peace of mind that you need, then I believe it is available.
I would say yes. I kind of look at it like how people look at HIV, know your status. And so I would say yes. Like Dr. Cook said, if you need that peace of mind, just go ahead and get tested. You can be, like she said, positive today or negative today, positive tomorrow. But if you need that peace of mind, just go ahead and get it done. It's free. You don't have to pay for it. So why not?
I agree with Dr. Cook as well. If you want to know, and Minister Valerie as well, if you just having a peace of mind, because I've had some patients that were negative one day and then go back and get checked and they're positive, and then I've had contact with that person, so that's the reason why you have to wear protective equipment, because you just never know.
Is the test really as invasive as they show, where they take the long what do you call it, Q-tip, and stick back your swab and stick way back in your throat through your nasal patch?
Yes.
Yes.
Yes, sir.
I guess he won't be
It's a very uncomfortable feeling. It's the same way you get tested for the flu, and I got tested maybe a couple of months ago. That was my first time ever. And yes, they take that long swab. It feels like it's touching your brain, but it's worth it. It's worth it to know. So it's only for a split second, a short period of time. So you can endure that for a short period of time, especially if it's going to give you results that's beneficial for you, your community, and your family.
Yes.
Right.
And
then there's a titer test now, Dr. Cook, correct? As far as getting your blood drawn to see if you have antibodies. So that only takes like a second as well. So not that.
Yes, that's true.
You had a post up here. Somebody said it wasn't. I think and y'all said it wasn't that bad. I said I guess that depends on the person's receiving.
Yes.
So that's good that you all are, getting tested and just making sure that you all stay safe. So that's a blessing. Someone had a question. I know you all talked about briefly introduce yourself, but I knew someone was going to be curious as to your initials. And so there was a question asking, what are the initials, Dr. Cook, behind your name? What are your titles?
So it's Doctor in Nursing Practice, Advanced Practice Registered Nurse, Family Nurse Practitioner, Board Certified.
Amen.
Okay.
That's a blessing.
Wonderful. Now, with this COVID-19, are you all seeing a rise or increase? I know I've gotten off of, I don't really look at the TV that much. So I'm just kind of behind a little bit, but are you finding in your personal experience in the healthcare, are you finding an increase or a decrease number of cases? I know it depends on the region, but like locally, are you finding?
At our hospital at Providence, we're finding a decrease.
Okay.
It's not as high as it has been in the past, so that's a good thing.
Yeah. That's good.
When occupational therapy, I mainly do home health. It's pretty much a decrease as well, or staying about the same rate with the patients that we get admitted with COVID-19.
From my perspective, of course, being virtual at this point, I don't see any. However, talking to some of my colleagues, they have seen a slight bump in the numbers just because everything is opening up. And then more testing is available. So you have to look at that as a factor as well, versus 4 weeks ago.
We had another question that came in as well. It says, if they got tested, they only swab the tip of their nose. Is that the correct way to do it?
I don't think so.
So they were supposed to stick it all the way back into, oh my.
So there's another question just kind of adds to that. Is there any other way to be treated, or is it has to go that way? Is there any other way to be treated, or it has to be there? It has to
Testing.
Yes, for its testing.
That's the only way I know as far as being tested for COVID is to have the swab that goes up the nasal passages. Other than that, it's the blood test that tells you if you have antibodies. In other words, if you have been exposed to a COVID patient, or if you have been exposed to COVID itself and have recovered, then you have a blood test that shows that you have antibodies built up against it because you've contacted it. But as far as being tested for COVID itself to know if you're negative or you're positive, the only testing that I am aware of, because I'm like, look, you, Lady Parrot, I don't look at the news a whole lot. I look at the CDC website every now and then just to keep a calm and a peace, because I see this, every day. Then you have to have that swab inserted up the nasal passages pretty deep, pretty far. I can't say how many inches, but it does go up there pretty far. Mm-hmm. And I don't know any other way except for that.
Wow.
And when you think about it, it's very simple. Go ahead. I'm sorry.
I would have taken the easy route out too. The easy way out. I would have taken the easy route.
Yeah. You want to say something about the
it's very similar, like she said, to the testing for influenza. So it's a virus. The best way to get it is through that nasal cavity.
We had another question that says, are you seeing any increase of anxiety within the people? And if so, or if not, are there any additional mental health resources that's available?
I'm seeing a lot of increase in anxiety and fear with the patient, and unfortunately, sometimes with staff members. So yes, a lot of patients have anxiety because they don't have their family members there to help them recover. Part of healing is having that spiritual or emotional support. A lot of people are close to their family members, and because they can't come in, they do face a lot of anxiety. So they're looking for healthcare providers to be more empathetic, more sympathetic, more compassionate, because they don't have those family members able to come in. They're not able to see them face to face. Some elderly are not technologically savvy, so they can't even talk to them on the phone. So you have to kind of posture yourself now as a healthcare provider more than ever to be able to pick up on those clues of fear and anxiety from patients, where at one time you wouldn't see it as much, but now you have to really be intentional as far as keeping them calm, keeping them relaxed, and just talking them through this time, because they don't have the family members there. And unfortunately, the sadder thing about it is you have patients in the hospital who are COVID, who are ruled out COVID, and who's negative for COVID, but they have other comorbidities. However, their family members can't come and visit them, so the anxiety is there. And then, as I said before, some healthcare providers, they're still scared, but they have to come to work because they have family members to take care of, kids to feed. So just because they're coming doesn't mean that they're handling it well. They're fearful, and they have anxiety, but all you can do is protect yourself and keep moving. Protect you, protect your patients, and keep moving.
With me in the nursing home, they kind of shut down the nursing home where family members weren't able to come and visit their loved ones in the nursing home. So a lot of the patients were a little stressed because they that physical contact again, or having someone to come and just bring them lunch. They're having a routine has changed, and it kind of affects the patients who have dementia, patients who have maybe some mental issues. So I see that in the nursing home and in home health. The anxiety, some patients just decline me coming to visit. They don't want anyone in their home because of this virus. So a lot of times I'm not able to get out to see that particular patient. So I might do a televisit with that patient just to make sure that they're okay, make sure that, they have everything they need. Because some patients I even have to come out and bring water to because they're not able to get out in the community and get it themselves. So a lot of them are just stressed. They don't want you to even come in their home. So that's a big issue in my profession.
The same thing with me as well. When I'm talking to my members, my patients, that it's a fear. It is an increase in anxiety because of everything that's going on, and them also being isolated. I have an older population, and they're not going to go out if they have high blood pressure, diabetes, or other comorbidities. As Minister Valerie said, they're staying in for the most part. And when they are going out, the good thing that I'm hearing is that most of them are wearing their mask and they're protecting themselves, and they're coming back into the home, and they're doing everything that they need to do in order to protect themselves. But they would prefer not to go out, but they're naturally very anxious about the situation.
We have, I guess, two questions here. One individual said that where they work, there are people that have tested positive for the antibodies, but they tested negative when they did the swab for COVID. And then another question was, I guess, so they want to know, is that something that's, usual or normal? And then we had another question was, are the hospitals still having an issue getting the PPEs?
At our hospital, we seem to have sufficient PPE. So at Providence, we haven't had any problems getting face shields, goggles, masks, gloves. We have not had a lot of the disposable gowns. We have more now of the cloth gowns, but they take them and they wash them and keep them keep them clean for us. So we have not had a problems with N95, surgical masks, or any shoe covers at Providence Hospital. As far as the testings, I have experienced that as well. We've had some patients who have come back positive. We had a patient just the other day who was going to get moved out to an LTAC facility, and we tested him. He was positive, and after a couple of weeks, we tested him. He was negative. He needed 2 negative tests, but when we tested him again after the negative, he came back positive. So it's so many questions in that area, because we're wondering, if you test positive, will you always test positive? Once you test negative, will you always test negative? And I think that because we're so not that far into this whole COVID and pandemic situation, that a lot of the answers to those questions we don't have yet. But we have experienced patients that test positive for the antibodies and then negative for COVID. Come back later, they test positive for COVID. So it's like you're up and you're down. There's no true finding that I can speak on tonight to give a definite answer one way or the other.
When you look at a virus in and of itself, you have to just think back to chickenpox. I know back in the day, before there was a varicella immunization or vaccine, when your brother or sister had chickenpox, they'd send you in the room and say, you go ahead and get it. Some kids did not get it. Some kids actually developed antibodies to it. And it's the same thing with COVID. That antibody test is actually saying that you've been exposed to it, but your body, for some reason, God gave you that inside your body that you just created antibodies to it, versus actually developing the disease. And because of the incubation period of COVID. You could have been exposed 2 weeks ago, 10 days ago, and you, like she said, you would be negative now, but then in a couple of days you could be positive. But those are the things that we are actually working through, and you can find a lot of that information on the CDC website and South Carolina DHEC.
So keeping your immune system built would help, I guess, fight against you developing the virus, or help your body could possibly become asymptomatic, or they don't really have any research to show one way or the other.
I haven't found any research to show that, but keeping your body healthy will help you in the long run anyway, because of course that wards off all the chronic illnesses that are associated with poor health, poor sleep, and all those other things. So you always want to keep your body in the best condition, because of course when your immune system is up, when your body is healthy, then you can fight off those things easier.
And that's good to know, because oftentimes we hear things, especially in the news or in media, and any type of resolve or quick fix will run to it. And so I just remember some months ago hearing about, oh, we need to double up, or you need to get your vitamin D. So now everybody is getting the vitamin D, which we need anyway. But it seemed like I read something today that indicated, okay, that could be dangerous. You don't want to, get too vitamin D. You need the amount that you're supposed to have, but don't go out here getting more than what you need, because that can cause some issues. So I'm glad that we're having this forum just to get, actual facts, and not, just kind of going off the hype of what we're hearing. So
as far as the vitamin D, I agree wholeheartedly with that, because in speaking with a pulmonologist at Providence, and as far as looking at labs that are similar between patients that are COVID positive, a low vitamin D is something that's common between them. Low vitamin D and different x-rays and different lab works, that's one thing that they do have in common. So yes, I believe just taking what you are supposed to have would help, but like you said, Lady Parrot, not in excess. Just whatever your normal doses or what it calls for each and every day.
Yeah. Okay, go ahead.
Oh, I was just going to say, some people may have had the COVID-19 virus and just it affected them differently, and they may have just recovered from it a lot different than someone who may need to be in the hospital. And so I think that's a lot to do with people who may have the antibodies built up in their system. Is they may have already had exposure to the COVID-19, had the virus, recovered from it, and then now, they're doing better. And so that may be the reason why they may have the antibodies and not testing positive for the virus.
Yeah, the question, we noticed, like I said, businesses and stores are opening, but also childcare, daycares are opening. Are you finding or hearing more children getting COVID or being affected by it? COVID-19?
We hardly ever see children downtown. So I'm not sure as far as that concerned with patients coming into Providence, because there's more heart patients and older patients that come into our facility. However, when I talk to other healthcare providers outside of Providence, they state that kids are getting it. I'm not sure of the statistics, but they present more, from what I understand, with GI issues, whereas in I guess diarrhea, nausea, vomiting, where adults present more with respiratory issues or heart issues and that type of thing. So I'm not sure what the statistics are when I went to the CDC website, unless I overlooked that and see as far as statistics on there either as far as children, whether they're increasing, decreasing, or maintaining.
I work with the aging population, so I don't know much about the youth being affected with the COVID-19.
The same here.
I was told, like up north, they had a lot of, begin to see an increase in cases of children. And it just depends on the area that you're in, so we're grateful for that. If there's none, we're grateful for that.
Amen.
There was another question that asked, as far as the testing, if someone was interested in getting a test, where would they go? Is that something they would set up with their doctor, or is there a certain clinic? Where would they go to get a test?
A lot of communities are setting up free testing, so you can look into your community clinics and stuff like that. Those are some areas where they are setting up free testing. If you want the testing, those are the only places that I know of. But I don't know.
Mm.
Dr. Cook may
Um,
know some other places.
I think
Yeah.
they suggest initially that you call your physician and kind of get a reference. And then after that, and I might get in trouble because I work at Providence, but Prisma Prisma Baptist is where a lot of people have been going. They've been signing on to their telecare conference or telecare website, answering a questionnaire, receiving a number, and going to Prisma to get their testing done. Like Minister Britt stated, there are a lot of places in the community, but where I'm at and who I talk to most of all, they said that Prisma Baptist is where most people will get their testing.
There were actually some advertisements about free testing centers located in and around the Columbia area. So if you have a question, you can always reach out to South Carolina DHEC or look on their website to find those. And I know that there are some private labs that are doing them, like I believe Quest and LabCorp are also doing some testing. I don't know if you would need a referral from your physician, but there are other free testing sites that are around Columbia where you do not need a referral from your provider.
Are you all seeing a lot of people with the conspiracy theories? Because they were saying that I was reading something today, and they were saying COVID-19 is one of the biggest conspiracies ever, with a death rate of 0.2%, and it's closed down all of these different entities. Are you all seeing people being very careless because of that? Are they feeling that way? Are people overly cautious? Are people really kind of taking it seriously? Those that are coming in.
I see both sides. I see some people being very careless, not wearing their masks, not washing their hands, which is one of the biggest issues that I have. People not washing their hands or not washing their hands properly. They just rinsing them up under a sink and thinking that's it. You know, you have to wash your hands properly. It's a technique to wash your hands so that you can remove everything off your hands, the germs off your hands. And then I see a lot of people that are well, I know of people that have died from this virus, as well as people who have contracted the virus and has recovered. And I'm seeing more people recover from it than die from the virus.
Good.
Mm.
That's good.
Mhm.
Now, is it really necessary, like I said, doctor's appointments that are not urgent, dental visits, routine visits? You know, doctors are calling saying it's time for your routine checkup, your dental. Is it safe to actually, you know, go ahead on and keep those appointments if it's not urgent?
I believe that all of the offices, whether it's dental, optometry, primary care offices, have actually implemented the CDC recommendations and are changing the way that they do things. So my suggestion would actually be to, when they call to remind you of your appointment, ask them what they're doing in their office to mitigate transmission of the COVID-19. Some people are doing virtual visits. Some offices are doing seeing one patient in the waiting room at a time, and you wait in your car, and they're doing vigorous cleanings between patients. So there are a lot of different ways to mitigate this COVID-19 transmission. So just find out what they're doing, and if you're comfortable, then go.
Mm.
I agree with Dr. Cook. I actually went to the doctor last week, and they were only letting 3 people in the waiting room, and then they also have included an extra waiting room where patients are sitting and waiting. Maybe one or two are in the second waiting room. So they, like Dr. Cook said, are implementing just more precautions with their care.
Okay,
I agree. I
good.
agree.
There's another question. Someone says, are any of you familiar with the new Android update that added a feature for COVID-19 and how it works?
Hmm.
No, I have an iPhone. I'm sorry. Look into that.
Wow, okay.
Sorry.
I think all of these mediums now are trying to put something in place to educate
Mhm.
people and to make people aware of what's going on or whatever. So I said we have to find out about the Android users that are familiar with that application.
A millennium asked that question, right?
What's that?
A millennium asked that question, right?
He's an older millennial, but he's still he's running the cutoff line out there.
Now, there was a question, we touched on it briefly as far as, people being affected by COVID-19. And I want to make sure that, those who are watching or if they know people that are being affected, know that there is help out there. Is there any type of mental, maybe resource or a place or a number offhand that you can think of if someone is needing help? Because this is one of the things that I talk about. Everyone's smiling, but at some point it does affect you mentally. So how do we handle that if someone is in need of that help?
Well, there's a website, which is a resource that I know of, is the National Alliance of Mental Health Illness website that you can go on to maybe see if you can get some more resources from that website to help you if you are in a crisis or you just need someone to kind of point you in the right direction. And I think they do it by state as well. I don't think South Carolina has a lot of mental health hotlines, but I know that particular website will kind of point you in the right direction. I don't have the number offhand, but you can go to the National Alliance of Mental Health Illness website.
Okay. National Alliance of Mental Health Illness.
National Alliance of Mental Illness.
Okay.
We had another question that popped up as well. They ask, how are homeless people being affected by the COVID-19? Do you all see a lot of homeless people come in, or they've developed a strong enough immune system, having to fight off other illnesses, or what?
Again, I work in the home and in a skilled nursing facility, so they actually have shelter. So I don't know about homeless people being affected. I'm quite sure they are in some way, but I don't know offhand.
Likewise, I work in the acute care setting, so unless they come into our ER and get screened like everybody else and come in and are taken care of, I'm not really sure as far as how the homeless people. I'm not in communication with any shelter owners to have asked them, so I don't know.
The same here.
I've seen the public buses running now as well, and just in looking from the outside, it looks like they have some kind of sign on some of the seats to ensure that people are being spaced out properly. You think people that are riding the public bus systems, they should be concerned or not as concerned now that things are opening back up? The numbers are not as high as they've been, and I think I saw as of May 16, they said that that's the first time we didn't have any deaths in a week or something since I guess March or something.
I believe everybody should continue to be precautious, regardless if we're having deaths or people are, the rate has decreased with people contracting the virus. But I guess the main thing is washing your hands, what the CDC recommended, making sure you're washing your hands, making sure you continue to wear your mask, especially if you're going out in the community, especially going into the stores and things like that. And just try not to wear the mask all day long, but just go in and get what you need and, get back home and wash your hands again, take precautions.
I agree.
No, go ahead.
I agree. I think they should, I feel like they should be even more cautious because what we have done up until now is what have allowed us to be able to begin to open up. And what we have done so far has been able to allow us to see the decline in the positive testings. So if we've done this, or done, what we've done to get to this point, we shall continue to do it, or do it even the more, be even more careful, so that we can continue to see the decline. And even as far as wearing the mask, when she says be cautious, if I could piggyback off of that a little bit, be careful when touching your mask, because that COVID can linger on the mask, and you see people touching it all the time. I usually try to go inside the mask or pull it down or pull it up, so you have to even be careful with touching the mask. Be careful with the surfaces, because we're not sure, like the studies are saying, some places are saying that it rests on the surface. Sometimes they're saying that it doesn't rest on the surface. So you just be cautious in that sense, that you continue to wipe things down, continue to, like she said, wash your hands and sanitize. But I think that whatever we have done thus far, we need to do that and more to keep it on the decline.
Mm-hmm.
Yes.
And to also,
Go ahead.
sorry.
Go ahead.
And to also add on to what they both said, the additional thing that I tell my patients and anybody that I see is, when you're going out to the grocery store or wherever it is that you need to go, and you're not lingering and you're wearing your mask, when you come back in, please don't bring your shoes back inside the house, because it does stick on the surfaces of your shoes, on the bottoms of your shoes. And another step further is, and this is not necessarily CDC recommended, but because we don't know for sure if it's in the clothing or how long it may stick to your clothing, if you've been exposed to it, take a shower, change clothes, put those other ones in the hamper and wash them. And that way, that when you're coming back into your house, you know that you're not bringing anything that, you may not want to bring back into your home.
Yeah. I agree with that.
Absolutely. I agree as well.
We got enough questions coming back in. We have time for one or two more, and then I guess we'll try to close out. We can probably grab those two together, and then we'll see what other one we can grab.
Okay, there's a question that says, have symptoms of COVID changed, and are you concerned about a second wave? We've been hearing about a second wave in I think China. What is your take on that?
The symptoms I see are still the same, except for, in addition, I see that patients are coming in testing positive with the fever, the cough, and the sneezing, and also with no taste in their mouth. A lot of patients are coming in and they're not having taste in their mouth. That's the symptom in addition that to other symptoms that I've heard of, that is a manifestation of COVID. And I am concerned about a wave period. I'm concerned about, I would say, yes, I'm concerned about a second wave if we don't continue to do what we know to do. I think a second wave will come, and it would be more detrimental if we ease up and let our guards down. But if we continue to do what we're doing and pray, seek the Lord, this is a Christian, forum, that I believe we'll be okay. But just don't let up off of what we know to do.
I agree with Minister Valerie. Use wisdom when you're going out into the communities. And I also have seen a symptom. What she said was the taste and the smell is eliminated. So some patients can't smell or taste anything. So that is a sure sign that they need to get tested. Doesn't mean that they have it, but they need to get tested, because I'm seeing more patients have that no taste, no smell, and they may not even have the fever, or they may not have shortness of breath just yet. So the symptoms are different with people. Everybody's symptom may be different. So again, what Minister Valerie said from the beginning, to have a peace of mind if you're having any kind of issues like that, you need to go seek your physician to make sure that you get help, medical help.
Yeah.
Yes.
I'm sorry. Go ahead.
Yes, that's exactly right. It's the loss of taste and smell are the two biggest ones, along with the GI symptoms in adults as well. So your nausea, your vomiting, your diarrhea, that GI upset, are some of the things that people are seeing in absence of respiratory issues in the beginning period. And I'm concerned about a second wave because even with today being Memorial Day, you can ride down the street and see people that were having cookouts and no one was wearing a mask. And it's really concerning. And I know a lot of my colleagues in the hospital that are hospitalists, they are concerned and they're scared because people are not staying vigilant in the social distancing and also wearing PPE and hand washing.
Yeah.
I guess that goes into one of the other questions here about how would this affect people that use Uber, driving and Lyfts, being in close quarters with strangers, kind of along the same lines with the bus situation. You probably want to stay vigilant and mask up the whole time.
Mm-hmm. They need to be masking up, and the people that are riding with them need to also wear a mask because you know that actually decreases the chances for transmission both ways. And in between rides, the driver needs to be cleaning their vehicle very well, very good, so that they're decreasing the chances of there being some kind of COVID or other virus that someone doesn't want being inside the vehicle.
I agree with Dr. Cook. If you have to bring your own Lysol and wipe down the vehicle before you enter it, and don't wear gloves. I want to say this: please stop wearing gloves out into the community because you're spreading the virus. You're spreading not just the virus; you're spreading germs. You're spreading other diseases. So I would just recommend that people not wear gloves, wear the mask, but not wear gloves, but wash your hands more often.
Mm-hmm.
I
Yes.
agree. And if you have eyewear, if you have shades that you can wear, do that because it's not just passed through the mouth and breathing in, but the particles, they're droplets. They can enter the mucous membrane of the eye. That's why they often say don't scratch your eye or keep your hands away or your fingers away from your eyes. So if you have sunglasses, sun protection is better than none. So if you have sunglasses or glasses that you can wear as a barrier when you are around people, do so in addition to the mask.
Mm-hmm.
Good. One final question I have here. It says, have you all felt respected by the community for your service in healthcare recently?
Yes, I have. I have really felt as far as them putting up signs that say heroes work here, or you go in a grocery store with your uniform on and they tell you thank you, for what you're doing. My only concern is that everybody is essential though. Even the dietary department, the housekeepers, everybody in healthcare, because we're all on the front line, whether they're in the room right then and there with that patient, or if they're coming in to clean the room. They're all at risk, but yes, I feel very respected, and I appreciate that. I appreciate it.
Mm-hmm.
I also feel respected as well, and agree with what Minister Valerie said.
Mm-hmm. Yes, me as well.
Yeah. Yeah. So you all out there, I know you may look crazy going to the store. It's getting hot. But please take the advice of these professionals. Wear your shades. You have to wear goggles. I laugh. If you don't have shades, please. Like I said, you may look kind of weird or crazy. And sometimes it's easy to go with the majority, but they're not wearing it but use precaution. The pandemic is not over. So please wear your mask. Graduations, there are celebrations. I know there are a few I've heard they're doing the drive-bys, stay in your cars if you can. Any outdoor events. I'm hearing that the beach, and I just told Pastor the other day, I'm like, I am so ready for a vacation. But even in that, I got enough sense to be patient and to wait. So, try to go to Myrtle Beach where it's crowded and, sitting and eating in these places just because they're open. But you definitely need wisdom. And don't go with the majority, especially when you have professionals who are telling you, to please do these things. Please wash your hands.
Well, I heard a guy, his some time ago. His name was Mr. CP. He was telling people, make sure you wear your goggles and your mask and all this kind of stuff. He said, don't leave out your Bible because you don't want to have a clean body and a dirty heart.
Yes.
So I tell you, all of these people are giving out great advice. I'm very appreciative to you all. We're not going to delay you on tonight, but we appreciate you all for coming out.
Thank you.
And investing your time and to share with us concerning this COVID-19 and how it's affecting you all in the workplace, how it's affecting society as a whole. We thank those of you that have been tuning in and have been a part of this dialogue. We appreciate you so very much. Those of you that are working on the front lines in whatever capacity, whether you're in healthcare or in some other profession, but you're risking your life every day to make sure that we get the things that we need and that we do know that we appreciate you all greatly. We want to pray for you quickly, and then we'll, I guess, release you all to continue to enjoy this Memorial Day. So, Father, we thank you now for all of these clinicians that have shared with us on today, those that have shared dialogue as it relates to this COVID-19 and how it's affecting them in the workplace, how it's affecting society as a whole. We pray, God, that you continue to keep them safe, that you'll keep their families safe, that you'll keep them in a place of peace in their minds. Don't allow what they see and exposed to on a day-to-day basis affect them in a way emotionally where it kind of causes them not to have the joy that you would like for them to have. We pray, God, for all essential workers everywhere, that you would allow the angels, God, to be dispatched all about them, to keep them safe from all hurt, harm, and danger. You continue to bless us individually and collectively. Thank you for those that tuned in tonight, oh God. Bless them in a great way because of their time invested in listening to this dialogue. And we thank you even for the questions that they shared. And we'll bless your name forever. In Jesus' name we pray. Amen. Amen. We thank you all for tuning in. We appreciate y'all so very much. Y'all continue to stay safe. And I guess we'll talk to you all very, very soon.
Yes. Love you all. Thank you. Good evening.
God bless you.
That's where I find strength. That's where I find joy. I've gotta be. That's where I wanna be. That's where I find hope. Lord, I wanna be in your will.
I know you've been challenged with trying to figure out the next step, the next move. But I do want you to know that it's all found in God's will. He won't leave you the way that he found you, but when you seek after him, he'll bring you from one level to the next level. The scripture writer says it like this: if you would draw nigh unto God, he would draw nigh unto you. Seek ye first the kingdom of God and all of his righteousness, and all of these things will be added unto you. Know that God didn't bring you this far just to leave you where you are. But after this, there's peace, there's hope, there's joy. Everything that you've been desiring in life, God already has it in store. I wanna be in your will. I wanna be in your will. Oh, Jesus. That's where I find joy. I wanna be in your will. That's where I find strength. That's where I find understanding. I wanna be in your will. In your will. I know I feel, but I wanna be in your will. Take me to his perfect will. I wanna be, I gotta be, in your will. That's where I belong. I wanna be, yeah. In your will. In your will. In his will is where everything that you've been seeking can be found. All right. Thank you all.
Good night.
Appreciate you all for tuning in.